Hi viewers, hope you're well and keeping safe. I'm Wangui Mwangi, a clinician, and today I'd love to talk about hypoglycemia, which is low blood sugar levels, that is below 4 millimoles per liter. Hypoglycemia is common in diabetic individuals or the diabetic patients, but in some rare cases you also find it in non-diabetic individuals. And you know that diabetes is very common in our countries. At least you have a friend, a relative, a family member who is diabetic. And once in a while they get into hypoglycemic state, and we may not know how to deal with the situation. So when we begin with the causes of hypoglycemia, for a diabetic patient who is maybe on insulin or the oral antidiabetic drugs like the sulfonylureas, you may find that there may be miscalculation of the insulin or overdosage of the oral antidiabetic drugs. We also have missing meals. A diabetic patient has taken their medication, but when it's time to have their meals, they fail to take their meals, and this would also lead to hypoglycemia. We also have strenuous or rigorous exercise, and we also have chronic diseases like the renal failure, whereby you find that for a diabetic who is on insulin and is also suffering from renal failure, normally insulin gets excreted by the kidneys. So if the kidneys are not functioning normally, you find that the clearance of the insulin may take longer than it should. So when there is buildup of insulin or too much insulin in the bloodstream, these would cause the sugar levels to go down. And for a non-diabetic individual, we also have various causes that would lead to hypoglycemia. For example, excessive consumption of alcohol without having meals. We also have taking diabetes medication by mistake. And we also have certain medications like the antimalarials, specifically quinine, which causes the sugar levels to go down. And we also have a tumor of the pancreas known as insulinoma, which excessively produces insulin. So when you look at the signs and the symptoms of hypoglycemia, one of them is that we may have excessive feeling of hunger. There is excessive sweating. You also have paleness of the skin. There is tremors. There is tachycardia. We also have gait. There is irritability, confusion. And if this patient does not receive the necessary care, they may complicate into unconsciousness or diabetic coma or even death if still they do not receive help. So it's very important to be able to identify these signs and symptoms, so that in case you note any of them, or if you're diabetic and you feel either of the symptoms you've talked about, you are able to take the necessary precautions. So if you experience either of the signs or the symptoms that you've talked about, or you're either diabetic patient and you note either of the signs, the first thing that you need to do is to have the sugar levels tested. And if the sugar levels are below the normal ranges that you talked about, you can take or give this individual sugar or a sugary drink, a juice, a soda or a beverage. You can also give these individual glucose or sweets, and you may also add a lot of sugar in either tea or coffee. And once the sugar levels stabilize, you can give this patient or individual a snack or a meal that is rich in carbohydrates, so that you avoid recurrence of the same. If this patient is in an unconscious state, kindly do not give any drink, do not give any glucose or any sugar or any food, as this may lead into choking or may lead to choking. Kindly take this patient to the hospital so that they may receive the necessary treatment, and do not delay so that you avoid the complications that we talked about. So if you are diabetic, kindly always have your sugars checked oftenly. If you're embarking on a long trip or on a journey, check your sugars before you embark on the journey, and also carry along a snack, a beverage, so that you avoid getting to hypoglycemic state. And if your sugar levels oftenly go down, kindly visit your doctor so that you discuss on what to do with him or her. Maybe change the dosage, the medication, because recurrence of hypoglycemia may lead into something that we call hypoglycemia unawareness, whereby you get into hypoglycemic state, but then you don't feel any symptoms, there are no signs, and this is very dangerous because you may complicate into maybe a diabetic coma or even death. So always visit your doctor, have your sugar levels checked regularly, and also visit your nutritionist so that you can discuss on the diet or the right diet that you should be following. Kindly subscribe to my channel. I hope you've enjoyed the video. Leave your comments. Thank you.